Hello, welcome back to my channel. This is Becky, and I want to talk a little bit about different types of therapies. Now, I just wanted to do a disclaimer. I am not a therapist. I am not a counselor. I am a teacher and educator. I am also a LLC, which means that I'm an entrepreneur that has limited liability. And my job is to educate people. So I don't diagnose anybody. I don't work within giving any sort of pharmaceuticals. There's no prescriptions. Everything that I give you will be natural stuff. It'll be like, gargle some salt water if you have a sore throat, right? So I am not licensed in any of those. I would outsource you to any trained professionals when it comes to getting any type of diagnoses or any sort of professional supports in that direction. I am just a trained expert in communication and behavior. And I am a licensed, certified instructor and educator. And so just wanted those clarifications out there so there's no confusion. So what are some of the types of treatment that are out there? Well, there's something called cognitive behavioral therapy. They'll call it CBT. And those are sessions that involve assisting clients with setting short-term and long-term goals. Then they have individualized treatment plans that are created and that involve techniques which focus on changing those unhelpful behaviors and thoughts. They have a heavy focus on practicing skills in between sessions. And the way a person thinks and feels is directly impacted on how they respond and behave. So the clients engage in non-judgmental discussions because the way we think can change how we feel. So through awareness of patterns and thinking, we can make the necessary changes in our lives to function more effectively. CBT is a broad term that allows therapists to assist clients using multiple types of therapies. Some strategies used include challenging thoughts, providing encouragement, and processing events. Another type of treatment is motivational interviewing. They'll call that the MI. This is used in developing awareness of ambivalence surrounding areas of behaviors that are difficult to change. It helps clients prepare to actively participate in addressing the barriers to change and then to face those challenges of change. Another type of treatment is acceptance and commitment therapy. They call that the ACT. This is an action-oriented form of treatment in which clients are guided to accept instead of avoiding feelings and situations that are distressing and often uncontrollable. By accepting these things and committing to changing one's behaviors, one can continue to move towards valued life activities. The ACT teaches that despite how a person feels in the moment, they can still choose to behave based on what they value in the long term. Mindfulness is also a key component of the ACT. This helps with accepting problems as they arise without feeling the need to intervene or to take control. It's also about giving yourself compassion, especially concerning one's relationship with difficult experiences. Another type of treatment is the dialectical behavioral therapy. I think they said that right. It is DBT. This focuses on the development of core skills that include emotion regulation, distress tolerance, mindfulness, and stress reduction. It also helps reduce self-destructive behaviors. Mindfulness skills can help a person stay grounded during times of deep emotional turmoil. By pausing and paying attention to one's surroundings and senses, an individual can slow down and be present in the moment. By remaining non-judgmental about the experience and not engaging in automatic negative thinking and behavior patterns, individuals learn to use healthy coping skills. DBT involves acceptance of who one is as well as acceptance of one's experiences and teaches skills to help people to be assertive in order to get their needs met in relationships. It also teaches skills of emotional regulation by helping a person to channel their emotions in a manner through learning to accurately identify their feelings and tolerate them. Through acceptance and change, people can begin to respond differently to their experiences. And the last treatment that I have on here is behavioral activation. They call that the BA. Is based on the belief that action precedes emotion. In other words, how you act will determine how you feel. Through increasing positive reinforcement of a desired behaviors, we can increase the probability of the desired behaviors continuing. So a lot of times I will, reinforce for parents and caregivers, whatever behaviors you allow will continue. So if you think that they will eventually outgrow something, that is not necessarily the case. So we want to be careful about just turning a blind eye to certain behaviors or certain communication styles, because we can change it earlier on, the better it is for that individual, because the brain will be able to rewire itself more quickly than trying to help adults rewire, all the programming that they've been through and throughout their lifetime. And so the younger that we can get these individuals help, the faster it helps the entire family, really, and the community. So thank you so much for listening to this message, and I hope you found it very enlightening. So if you did, please go ahead and click the subscribe button and like and share it so we can get the message out to more people. I greatly appreciate everything that you're doing. So keep up the great work, and I will talk with you in my next video. Have a great day.